to travel, journey, voyage, expedition, tour, pilgrimage, safari, odyssey, to boldly go where no one has gone before. Welcome to our podcast, Travel Unravelled, an ISTM podcast sponsored by the International Society of Travel Medicine and IMAT, the International Association for Medical Assistance to Travelers. Hello, listeners, and welcome back to Travel Unravelled. I'm Dr. Aisha Khatib, the podcast director for the International Society of Travel Medicine. This episode is sponsored by IMAT, the International Association for Medical Assistance to Travelers. And I am absolutely delighted to welcome our listeners to a very special in-person taping of Travel Unravelled at the American Society of Tropical Medicine and Hygiene 2025 annual meeting that's being held here in our home city at Toronto, Canada. So joining me today is our Travel Unravelled host, ISTM President, Dr. Anne McCarthy.
Hey there, how are you?
Anne. And our newly minted appointed president of the clinical group of the ASTMH, Dr. Henry Roux. So Henry, welcome.
Thanks, Aisha. Well, happy to be here.
And Henry is the director of Emory University's TravelWell Center, a clinical hub focused on preventing and managing infections related to travel and migration. So how's the meeting going so far?
It's very untropical outside, and we haven't gone outside the convention center, but we're surviving.
It's true. We had our first snowfall of the season, so we hit about 15 centimeters of snow. Our other co-hosts, Albie and Sarah, are not joining us today, but Henry also just tried his first Timbit, which is, does anyone know what the Timbit is? Non-Canadian?
Not really.
You just, the test question?
Yeah.
Do you like it?
Yeah, of course. Very nice.
Steve, you want to explain what a Timbit is?
So the Timbit is the donut hole. And so we don't waste any part of the donut here in Canada. We basically take the donut holes, throw them all in a box, and then we sell those to people as well.
Very smart.
And they're delicious.
Delicious.
All right. So today we will be talking about something that most travelers try not to think about, parasites. So those tiny little creatures that can hitchhike a ride home. And trust me, it's more common than you think. So I'm going to pass it on to our hosts for today's episode, Henry and Anne, to introduce our speakers.
And just before we start, I want to say it's actually the clinical group of ASTMH who are co-sponsoring this today. And we're very thrilled to have them. So today we have two incredible guests joining us on our podcast. I'm very pleased to welcome Dr. Carlos Diaz. He's Associate Professor of Medicine at the Alexander von Humboldt Tropical Medicine Institute in Cayetano University in Lima. And many of us in the room have done at least one Gorgas course, and everybody knows Carlos as an amazing clinician and teacher and a great guy to be around. We also have one of my Canadian colleagues, Dr. Stephen Vaughan, who's a tropical medicine colleague from Calgary, Alberta. And Stephen has developed and leads our national tropical medicine rounds and our national WhatsApp group in Canada. We all talk to each other all the time about our tropical medicine cases. All right, so let's get into it, guys. These parasites that we're going to talk about can show up on your skin, in the food you eat, or even from the bites of insects that you might not even notice on your trip. Travel medicine data shows that travelers visiting friends and relatives are at higher risk than other types of travelers. So even if you think you're careful, there's a chance you might pick something up that'll hitch a ride home. Carlos, maybe we'll start off with you. What's the first thing travelers should know about the kinds of parasites they might encounter?
Well, thank you very much, Anne. Thank you very much, Aisha, for the invitation. It's really, truly an honor. Let me tell you that I'm a regular follower of this podcast since the last time that we met, which was in New Orleans, that Aisha actually introduced me to the podcast. I'm a regular follower.
Oh, I'm honored.
So thank you very much. So I actually never miss one of the episodes. Anyway, Anne, as you said, well, first of all, I don't want to scare the travelers, but actually by things that they may do, they may actually get the parasite that we are going to discuss today. And I would like to start with one anecdote that I have that actually depicts, the risks of these travelers in getting some parasitic diseases. This is a real story. I was called to see this patient. This is a guy from Spain that had a dream. You know that the Incas, they used to communicate each other through the vast empire by road, walking, running. So this guy had a dream of actually driving from the north of Peru to Cusco. So he flew from Madrid to Ecuador. Then he bought this van and then started driving and used the van as a hotel. So he stopped by any place, eating whatever, and ended up in Cusco like a month and a half after, and he was evacuated to Lima with abdominal pain and fever. Just to make the history short, he had an amebic liver abscess. So his doctor phoned me from Madrid and said, "What is that? How this gentleman got it?" And then I explained to him. In the meantime, he had diarrhea and some other things, but actually he got that. So actually he is an example of maybe an adventurer traveler, who was exposed to many things, eating on the streets and things like that. I don't want to scare the travelers, but I think that we're going to teach them today, how to avoid things like that.
And Stephen, from your perspective, you work here in Canada. How do you typically run into these parasites?
Well, first of all, thank you very much for having me today. I'm honored to be here with legends in tropical medicine. So typically in Canada, we work at a post-travel tropical infectious diseases clinic. And so we'll see patients that get referred either to the emergency department or when we're on service that will come back. And just to share one story as well, we had a traveler probably 6 or 9 months ago who traveled to India, had a number of potential exposures while they were there, and then came back to Canada, got extensive investigations, and was found really to have a high eosinophil count. So this is a type of blood cell that's associated with parasite infection. We ruled out all of the sort of more common things, and eventually we diagnosed this patient with tropical pulmonary eosinophilia. So this is a lung-mediated inflammation from parasite that was passing through their lungs. And it's from the bite of a bug, and you can get the infection that way. So fortunately, we were able to make the diagnosis, get them on treatment, and he's feeling perfectly well.
So now we're going to talk about how to actually avoid bringing home some of these unwelcome souvenirs. Let's start with the skin and topical parasites. They're the ones that often make you notice something on your skin first. It may be a rash, it may be a lesion, brings you to maybe multiple healthcare providers. It may be innocuous or it might be quite serious. Stephen, you're going to tell us about cutaneous larva migrans.
I can tell you about cutaneous larva migrans, CLM, as we often refer to it. It's a fairly common thing that we'll see in our returning travelers. So in Canada, as people are now aware, it snows a lot in the winter. So people will travel to the Caribbean is a very common place where they'll go, whether it's Dominican Republic, Jamaica, or Mexico.
Miami too. Saw a few cases from there recently. Go on.
What you may notice while you're there and you're enjoying the beautiful beaches is that there may be dogs running around on the beaches. And unfortunately, in that type of setting, the dog defecate into the sand. And if you're laying on sand, you're walking on the beach, you wouldn't even notice that it was there. You can actually have a small worm that can penetrate through intact skin, and it causes these blisters, usually on the feet, on the buttocks. Sometimes we'll see it on the back if someone's laying in the sand. And it's quite interesting. You can actually see the little track or the little burrow where it's moving underneath the skin. And it's extremely itchy. So these patients will come in, we'll see them. There is a very good antiparasitic treatment, and we can get them treated.
These patients leave me feeling itchy after they come into the clinic.
Absolutely.
Yeah. One of my most favorite and memorable cutaneous larva migrans was a male model who decided to sunbathe nude when he was in Jamaica. So we had to check out every single one of these lesions.
I bet you did.
Let's talk now about myiasis. Carlos, this infection, in my opinion, gets a little nastier. We're talking about maggot infections. Is that correct?
Yeah, that's correct. That's correct. This is actually more common than initially thought. So what happened is that we are going to talk about what is called the new word, myiasis. So essentially, there are two forms of this. One, which is, I think, the most common for travelers, which is called furuncular myiasis. So what they present is with a furuncular lesion, right? And they are usually been seen by doctors who really have no idea what's going on. They treat with antibiotics and they don't respond. So what happened?
What is a furuncular lesion?
Good. The furuncular is initially a papular lesion, so an elevated red lesion that has a purulent material inside. Right?
Sounds lovely.
Right? Yeah.
Like
really
a
nasty.
boil. Like a boil.
Like a boil.
Yeah.
This is really nasty because what happens is that these patients are not diagnosed properly. So what happened? What happened is that this is a very smart fly, actually. So actually, it's a big fly that actually lay eggs on mosquitoes. The fly doesn't directly, inject the eggs, but it's through the mosquitoes. So once the mosquitoes actually poses on the humans, but preferentially on cattle because they are bigger, they actually deposit the eggs, and it's usually one egg that crosses even intact skin. There's no need really for a break on the skin. Anyway, so that's what we see on the new word. It's called a dermatobia. So what happened is that the larva has to, develop into the humans, and that usually takes weeks. There is a common mistake in my country that people say that the fly actually will eventually, be pop up from the lesion, which is not true. What happens is that in humans, this larva has to develop over weeks and then has to be eliminated to pupate on the soil. But anyway, in the meantime, this is really, for the patients, it's really a nasty experience because sometimes they see it is painful and they see this is something moving inside. So, and finally, what happened is that most of the doctors really are not really prepared, to remove the larva. Anyway, and sometimes even the patients destroy the larva. So where to get it? From Central America, from South America. In Peru, it's very common for those who travel. It's common for those who travel and to go to the Manu Park, which is very famous for tourists because it's a place where you have significant number of birds and animals to see. So they may actually get that. And how to prevent that is essentially, all the steps for avoiding mosquito bites. Essentially, that's what they should do. And finally, my advice is that if for some reason, they see a lesion like that, a boil that is not responding, look for a local doctor. They usually know what to do, or they can refer the patient to centers where they know what to do.
So if you're unlucky enough to get one of these, how do you get it out? Do you just wait for it to come out?
Good. Well, there are two things you can do. One is to asphyxiate, suffocate the larva, to put something on top. That I don't know what's your experience, but my patients really don't want that. They want that maggot to be removed immediately. And then what you do is you remove it. So it's usually a cross section, and then you actually remove it. Yeah, that's what
I've actually used a venom extractor once.
Oh, yes.
The tropical disease unit.
Yeah.
And we usually just use some Vaseline in a cap and put it on and tell them not to look for 24 hours.
Yep.
And I put a great picture on our site that people can look at. Somebody came in with these caps duct taped to their skin.
Yep.
And it was very entertaining.
But the evolutionary biology of this fly laying eggs on this mosquito is something that's pretty incredible, actually. And I think there's a YouTube video that it actually shows this in slow motion. I don't know if you've seen that. Maybe we can get that up on the imaging.
I have to tell the story of the one time I tried to coax it out. I had a lady with a large one on her head, and I did the Vaseline, an occlusive dressing. I sent her home. She was up all night with this thing, getting angry. She came back the next morning and said, "I want this out now. You just pissed it off." So
that's what happened to me. My anecdote on this is one day I was in the clinic and I received a phone call. It was clearly an international phone call. It was from Switzerland. So it was a doctor who was a professor of mine. So his son was in the Manu Park working with the indigenous populations there anyway. So, and he got two boys, one here on the scalp and the other one on the leg. So it was seen by a number of doctors, and they thought about MRSA. So it started on trimethoprim sulfa, no response. Anyway, so he went to see me. All what I did, and it's a suggestion for clinicians, is I just observed the lesion less than 1 minute, and then I saw a bubble coming out from that. Bingo, and that's it. Then I asked, these are the options, as Anne said. And he said, hey, look, I had this in my head for like 2 weeks. I don't want to have this one more day. So just remove it. And then we did it. And I actually posted the images on the webpage. Anyway.
Thank you. Stephen, I've been hearing about something in the news, some form of myiasis called New World Screwworm. What can you tell us about that?
So New World Screwworm, it's getting some media now. And what we've actually seen is it's been reintroduced north of the Darien Gap. And so down in Panama, this myiasis was previously restricted south, so just in South America. And it now has crept its way across and is back up. And there have been sightings of this parasite in the United States. Now, to the best of my knowledge, there have not been any human cases, but there have been cases in cattle as well. This form of myiasis can be extremely destructive. So unlike other types of myiasis, where sometimes the fly will just eat dead tissue to clean up a wound, and in fact, that's a strategy that's been used in medicine previously with certain types of flies, this maggot will actually eat viable live tissue. So if it is on your skin, it will just continue to eat the tissue until you remove it. So I did see a case of this actually when I was in Peru a few years ago. Typically, the patients you'll see it on are those that can't care for themselves as well as they should. So either cognitive impairment, chronic wounds in a long-term care facility. But I think now with it moving north, we need to be hyper vigilant. And I know that there's a lot of concern, particularly with regards to the cattle industry.
Wow, that sounds absolutely terrifying. All right, let's move from it gets under your skin and things that get into your gut. So we spend a lot of time in our travel clinics, talking about folks about, things you can get from what you eat overseas, where they eat different things or standards of sanitation differ. Carlos, let's start with you. Let's talk about something called Paragonimiasis. What is it, and what does it cause?
I have to say first, when I go to Peru, Carlos says, do not eat any of the salad. And he also does not eat any of the salad.
And I'm very careful. So anyway, there's a nice question. So roughly, the parasites in the intestine can be divided in the rounded ones, like Ascaris, like any others, and the flat ones. The flat ones can be long, the Cutaneous, and the short ones. These are the Paragonimimus. So the Paragonimimus is a very short, flat. So how do you get it? Essentially, you get it by eating what is called freshwater crabs, crayfish, right? Why? Is because in the places where this is endemic, they used to eat raw crabs, raw crayfish. In my country, in Peru, where ceviche is very common, they actually make ceviche from crayfish in certain parts of the country. And that's a traditional food. So you go there for some reason and you stay some days in the rural areas, they are going to invite you that. And it's very difficult to say no. So you have to know that one of the risks for getting Paragonimiasis is actually eating raw crayfish, eating raw freshwater crabs. Where it is endemic? Well, in Latin America, from Mexico to the north of Argentina. It is endemic in Southeast Asia. You get it by that. And how to avoid it? Well, that's the tricky part. So actually, first of all, believe me, you are involved in the aquatic communities and everything. Try to avoid traditional food. I know that it will be impolite for you to say no, but there are some ways, of telling, sorry, that, I don't want to try that. But the other thing is avoiding actually freshwater crabs, crayfish. That will be the best way to avoid that. What happens if you get it? The parasite actually goes to the lungs. And the bad news for for those who get it is that the parasite can actually live there for more than 20 years, shedding eggs, and some people are mildly symptomatic. Some people develop symptoms that are similar to TB. As a matter of fact, Pedro Lewa is here on the auditorium, and we actually saw with him one patient that was actually misdiagnosed of TB because it has cavitary lesions and has like something like hemoptysis, which was not hemoptysis, and ended up having Paragonimiasis. And as Stephen mentioned, this is a kind of parasite that causes eosinophilia. So certain elements of the white blood cell actually go up when this parasite migrates to the body.
So, Carlos, every time any of us go to Peru, we eat ceviche. Who here has eaten ceviche in Peru? There you go. So are you saying that we shouldn't be eating ceviche?
No, look, my experience, ceviche is safe. My experience, believe me.
It's fish.
Right. I eat ceviche every single Sunday in my life. Cantarana, where we've been together, and some other restaurants. So the point is that the ceviche in Lima and along the coast of Peru is actually made of fish. Raw fish. So this is safe. There's no cholera. You're not going to get practically nothing from the fish. It's totally different.
Right?
Right. It's seawater.
Right, okay.
The other one is fresh water. I mean, we, the Peruvians, are not used. I mean, those who live in the coast, we are not used to eat, crayfish at all. If we are offered that, I say, well, looks weird. We're not going to try that. Anyway, so eating ceviche is safe, actually. It's not cholera. Last time we had cholera was in 1998. Since then, there's no cholera in Latin America, actually, for practical purposes. So getting this tremador, actually, Paragonimus from the fish is zero, is nil. There's no risk for that.
Can I just make sure that people know in the audience and beyond, TB is tuberculosis, you mentioned, and hemoptysis is if you cough and spit up blood. So just so we make sure.
And just to tag on to that, when you mention this can mimic tuberculosis, it's incredible that if you make this diagnosis, you just give a couple of days of an antiparasitic, the patient's symptoms all melt away and they do incredible, as opposed to 6 to 12 months of drugs for tuberculosis.
So great comment. Yes, excellent. Yep. Yeah, that's true.
All right. Now I'm going to put Henry on the spot. Carlos mentioned amoebic liver abscess, but maybe you can tell us a little bit about amoebiasis and amoebic dysentery.
Sure. The travelers' diarrhea, it's common. We all get it once in a while. Maybe you don't even need to travel. But
we're in Toronto. Okay, come on.
The many causes out there of diarrhea, and one of them are protozoan parasites, of one of which is the amoeba, and I think we can all picture that. It's an amorphous organism. Now, the good news is most of these don't cause much illness, but there is one species, Entamoeba histolytica, that can cause diarrhea, particularly a dysenteric syndrome, which is kind of a bloody diarrhea, often with pain and even fevers, and it's fortunately not as common, but it can also do some other unusual manifestations. And I'll tell you the story of a patient we once saw. He had worked in Central Africa, in various countries in Central Africa for several weeks, came back, had an episode of traveler's diarrhea a few days afterwards, even had some antibiotics, some ciprofloxacin to self-treat with, and he got better. So, problem solved. And about a week later, just started to get fevers and abdominal pain. And of course, hearing this story, I was thinking malaria, and he was actually looking sick enough. We sent him to the ER where they found a 7-centimeter abscess in his liver. And so this is a case of amoebic liver abscess. So again, it's not the most common manifestation, but this amoeba can go beyond the gut and invade and get into the bloodstream and make it to the liver, and even occasionally other places, the brain and the lungs.
And for our listeners out there, what is an abscess?
An abscess, well, it's sort of I guess it's like a pocket of infection, a pus pocket. So when we probably see them more typically on our skin when a zit gets infected. Well, it can happen anywhere in your body with all kinds of things, and in this case, it can be a large collection of, basically in this case, amoeba in the liver. that is usually treatable with anti-parasitic drugs, but occasionally also needs to be drained, as in this case, eventually needed a drainage procedure. Carlos, you got us started on some interesting some worms, and I want to ask you more about one which I always have trouble pronouncing. It's Gnathostomiasis and cause of Gnathostomiasis. And this one is kind of a out of a sci-fi movie. I mean, I just think it's a fascinating one. But this is a real thing, and tell us more about that.
This is really a fascinating parasite from a medical point of view, but it's not really good for the tourists or for the travelers. Anyway, so this is a nematode. So remember that I mentioned that the parasites can be, that you actually ingest may be rounded. This is a rounded, but the humans are not the definitive host. So what is a definitive host? The one that harbors the adult form of the parasite. So for this one actually are dogs or cats. So anyway, the life cycle of this is complex. I'm not gonna go through that. But humans get the infection in South America essentially by eating raw fish. Okay, so again, this is a question. There's a question on the ceviche, and the straightforward answer is that if you go to the restaurants, and I'm not making any propaganda for any restaurant, to the restaurants that are listed on your guided books, these are safe places for Gnathostomiasis. The point is that for the adventurer traveler that actually go in South America, in Mexico, in Peru, essentially to, street vendors and try to eat, cheap ceviche, then they are at risk. Then it's extremely common also in Thailand. I've been in Thailand and I saw the most, terrible cases of Gnathostomiasis. So what actually this worm does, as it doesn't recognize humans as their definitive hosts, they are not going to mature into humans. They actually go anywhere. Basically, what they cause is an inflammation of the skin. So usually you see, which is moving because the parasite moves, as with the cutaneous larva migrans. So it causes actually not a single linear lesion, but actually is like a severe inflammation that moves, and it's actually painful. The bad news is that the parasite, this larval stage, can actually be in the human being for actually years. It can be like 4 or 5 years or even more. So anyway, so how to avoid that? So then you had to be very careful on eating in South America, raw fish in the designated places. I've never seen really a person that actually got Gnathostomiasis by eating ceviche in a good restaurant in Lima. Believe me. So I have an anecdote. This was a Peruvian American person. Yes, he was a wealthy person. And then she bought a very nice house in the south part of Lima. And, to be very friendly with his neighbors and friends, she learned how to do ceviche, tiradito, and sushi. But, she went to a very cheap market and bought obviously not the good fish. It is not the fish that you're going to eat on the best restaurants in Lima. So, and eventually she got the Gnathostomiasis. So she went to the U.S. She was not properly diagnosed in the U.S. Went back to Lima, Gnathostomiasis, treated, went away. But anyway, so the message is, you can safely eat ceviche as I do, but you know where to eat that. And we have to be very careful, not on the street vendors, not on restaurants that are not listed, on the guided books. That's what you have to do.
And I'm going to throw this one back to you because I did the course with you in Thailand. And I remember at Mahidol, there's an entire Gnathostoma clinic.
There is.
And from what I recall, right outside the hospital is a stand where they sell raw blue crab salad. So can you tell me about that a bit?
There is. It's buyer beware for a lot of this stuff.
I have to jump in here. I just have to tell one more story about Gnathostoma. So this is a true story. Just after I'd finished my infectious diseases fellowship, I was on literally my first weekend of call in the home IV antibiotic clinic. Patient got referred to us and had cellulitis, so infection in the skin about 2 or 3 weeks before, got some antibiotics, some oral antibiotics, everything got better. Represented and now was referred to our clinic because if the oral antibiotics didn't work, maybe they need IV antibiotics. So I took the history and, I thought I was pretty smart at that time and I'd learned a lot from being at Gorgas and being in Peru. Completely missed the diagnosis initially and then walked out of the room, looked at the patient's blood work and that eosinophil count was significantly elevated. And then I walked back in the room and asked the person, I was like, what do you do for work? And they told me. I was like, do you work abroad? They said, yes. I was like, where were you? Colombia. Do you like ceviche? Yes. Boom. Made the diagnosis. And they had these migrating subcutaneous lesions that was classic. And I'd actually taken that weekend of call from one of my very senior colleagues who said he's been looking to make this diagnosis his whole career. And I literally got it on my first weekend. It was incredible.
Stole it from him. Okay, so take-home message, no raw fresh crab, no raw fish. That's what I heard. I don't know what the rest of your
Freshwater fish.
freshwater fish. What about the lovely little things like water chestnuts and other things that plants you might eat? Steve, do you want to talk to us about what we can get from them?
Yeah, so there's another type of worm. So it's called Fasciola. What's really interesting, again, I won't go through the whole life cycle, but this one can actually become embedded or encrusted in certain vegetables. And so we tend to see it in watercress in particular, and you can see it in lettuce as well. And so if you're traveling in a country that has this, and the distribution is somewhat similar to the other ones that Carlos has described. You see it in South America, a little bit in Mexico, and then in Asia as well.
And Alberta.
And Alberta. Very interesting. In Canada, we actually do have cattle and elk that actually carry this parasite. And so we were fortunate to actually make a diagnosis of someone that had not traveled outside of Alberta. I say fortunate because then we were able to treat the patient and get them better. But typically you would get this while you were traveling. Even if you were to wash your vegetables, you actually can't wash this encysted parasite out of the lettuce or out of the watercress. So you need to be extremely careful in terms of eating vegetables. And then what happens? Well, it actually goes to your liver. It can cause very painful, a lot of pain in the right side of your abdomen. That typically lasts, a few weeks, usually a couple of months actually. And then the parasite actually migrates into the bile duct. And sometimes you can actually get almost a gallbladder attack type symptoms. And so these are the things we see with that.
What about if you cook the greens?
That's a good question. Carlos, if you cook the greens, do you know?
Yeah, it's a very nice question because this actually, the the larval stage can actually resist till 60 or 65 degrees Celsius. So you have to actually boil it to kill the parasite. So, which, people really don't like to do that. With lettuce or with, watercress, they don't want to do that. I have an interesting anecdote to complement that. It's going to be short. This is a gentleman who was diagnosed with prostatic cancer during COVID. So he was a wealthy man. So he actually bought a big farm in Cusco. So a millionaire to buy a farm in Cusco. Anyway, he went there during COVID and then he was trapped there in Cusco. He couldn't come back. So the diagnosis was sent to him, prostatic cancer. Of course, he has to be surgically intervened, but there was a problem with that. And anyway, and then he started to present with abdominal pain, with fever and things like that. So then he was evacuated to Lima as an emergency situation. And they did an MRI, CT scan, all the things, and they found lesions in the liver. They said, my goodness, the first case of metastasis of prostatic cancer in the liver. And they actually did a biopsy full of eosinophils. Nobody looked at the eosinophils in blood. And it was fasciola. Anyway, so I treated him for fasciola, and then he was treated for cancer.
I know we need to move on, but just one more. We actually had a patient who had pain in their abdomen. They thought it was a gallbladder attack. And then when the gastroenterologist, they put a scope down up into that area, expecting to pull out a stone, and they pulled a worm out of the common bile duct. And I actually have a video, and you should hear what's going on in that endoscopy room and the things that they're saying. This is not something they were expecting at all.
Maybe we can get that video up for the podcast.
I have it. Yeah.
Yeah. Well, I have to say that I did try to order a vegetarian pizza on the phone when I was in Lima, and sin alpha. My Spanish was not very good at the time, and the pizza came with extra alfalfa.
Extra.
I was sitting there. I'm gonna get
you
fasciola.
You got con rather than sin. Right?
Yeah.
All right. So now we're going to talk about the things that you often don't see coming. Things you can get from bites of mosquitoes and other types of insects. So we're going to talk first about leishmaniasis.
Yep. So, unfortunately, Latin America is endemic for leish, actually from Mexico all the way to Central America, particularly in South America, particularly Brazil and Peru. There are a number of different species. How do you get this? By mosquito bites. These are tiny mosquitoes that usually bite you, after sunset. And these are really tiny. Sometimes you cannot really feel, the bite or even look at the bite. And then what happens is that over some weeks, these patients develop skin lesions. That can be missed, why? Because the lesions are usually painless initially, right? So I have an interesting anecdote again, full of anecdotes. This was really nice because this was a couple that was a wealthy couple that actually wanted to get married in the Dominican Republic. I don't know if there is someone from the Dominican Republic here on the audience. Anyway, so they
We get
decided.
about 1 million travelers in Canada who
Of course,
go
going
to
to
the
the
Dominican every
The
year.
Dominican Republic is safe, but you go to the main places, where they used to go. So, but this couple decided to get married on a very old church near Punta Cana. It was not in Punta Cana, but it was near Punta Cana. Altagracia, I remember, was the name of the place. So they went there, and of course, they were so happy that they were dancing till very late at night. And then about 3 weeks later, he developed skin lesion. Was seen in Peru by a number of doctors, no diagnosis, finally leishmaniasis. Nobody believed that leishmaniasis was endemic in the Dominican Republic. It is. It is not very common, but it is. So you get by mosquito bites. How do you avoid that? Essentially, using all the measures that you guys know on how to avoid, mosquito bites with repellents, long sleeve, shirts, pants, etc. Essentially, the mosquito is very small, so the regular bed nets that are used to avoid malaria are not useful. You had to use special ones. But most of the resorts in the Dominican Republic are air-conditioned, so by air conditioning a room is usually enough, to avoid getting those.
So,
these are the leishmanias.
Yeah. One of my favorite stories, Costa Rica is a very common place for us to see cutaneous leishmania from travelers. And I remember 2 guys went to this eco-tourist lodge that had just opened up, and they must have built their cabin on top of a sandfly pit. And one of the guys used to sleep like this. So he had lesions all over. And the other guy covered himself up, and he only had like 3 lesions there. But it was hilarious because sandflies, like you say, are such poor flyers. You almost have to attack them. They don't attack you, right? So
can you describe what some of these lesions look like? Like, what do the travelers usually present with when they present with these lesions from leash?
Well, they usually present with cutaneous lesions. They are a small papules, small red lesions, very small, that started to grow very slow too, and over a couple of weeks. And then they ulcerate, typically ulcerate. What doesn't mean that, there is a hole usually in the middle of them. And interestingly, these are painless lesions. For some of the species, you may see the original lesion and then also a very small satellite lesion aside. That's all what you're going to get, And And so a clinician that is experienced with that will actually suspect and will make a diagnosis. But many times, this go unnoticed. And depending on the place of your body too, because these are painless. Usually patients really don't notice until finally, grows enough, for them to see them. That's what you usually see. But in South America, particularly in Peru, Brazil, Bolivia, Colombia, there is one species in particular that causes cutaneous, but then years after may actually cause mucosal. I don't want to scare the travelers, but you get leishmaniasis in South America in particular, then your doctor is going to instruct you that he has to follow you for some time, to see whether you develop the mucosal lesion.
And the mucosal, which is in the nose,
usually in the nose,
or in the back of the mouth.
Usually in the nose, on the palate, usually there.
Yeah, Steve, where else can you get leishmania?
So you can get leishmania in a number of places. We see it from the Middle East fairly often as well. Afghanistan, Pakistan would be some other common places. And I would say the way that we typically see it here in the returning traveler is kind of the same. It's often a non-resolving spot on the skin that slowly enlarges. Sometimes people will say that it has the appearance almost of pizza. It has rolled edges and then can have a wet base to it as well. In medicine, we like to use food to describe a lot of the things we do. And then we can make the diagnosis on a biopsy. Another interesting thing to what Anne said earlier when she talked about Costa Rica, everyone that goes to Costa Rica loves to do ecotourism, and they love to hold the sloths while they're there. Well, the sloth is actually one of the reservoir animals for cutaneous leishmaniasis.
I got to add a couple cases. Add to the list of countries. Southern Europe, the Mediterranean region has old world cutaneous leishmaniasis, and because many physicians aren't looking for parasites, it's often missed. We've seen a couple cases. One was misdiagnosed as skin cancer. Now the good news is it wasn't skin cancer; it was a treatable infection, and the other one was actually more challenging to treat, and it just kept on growing, and it was the size of an egg. It was a large nodule under the skin. This was acquired in Italy, on the Amalfi Coast.
So Henry, you do a lot of pre-travel medicine at Emory. So what would you tell your travelers? How do they protect themselves from this?
Well, I think it goes back to our general advice for a lot of infections that are passed by bugs. Just don't get bitten by insects. That applies anywhere, really you go. You can name the things you can catch in any part of the world. And speaking of advice, I would love to hear in this lightning round some quick fire advice from you all. Carlos, do you have any quick advice to give travelers?
Yeah, well, actually ask for pre-travel advice. This is one, and then follow the recommendations, and then very simple things, try to avoid what we mentioned, raw crayfish, raw crabs, raw vegetables, particularly in certain parts of the world, as we mentioned, and then, follow all the recommendations to avoid mosquito bites. That will be essential really to actually avoid most of the diseases that we actually mentioned.
Any specific ones that you would tell people?
Any specifics?
Like specific for how to avoid insect bites?
We are talking about parasites now, but that this vectors really transmit some other things during the day. So the idea will be, to be protected throughout the day. DEET is the substance that you should use. It has a fixed combinations that, are really advised for travelers. Then long sleeve, trousers, and also what else? What repellents, and as said, bed nets, rooms with air conditioning. Those will be the things, and then reduce your activity, which is difficult for a traveler, at night. That will be actually essential to avoid, mosquito-borne transmitted disease.
And it's very difficult for us when we go to a warm place to then put on long sleeves, but these are the recommendations, and particularly if there's a lot of biting mosquitoes that are around. Another strategy that can be helpful is if you have clothes, you can actually have clothes that are impregnated with permethrin, which is an insecticide. And so you can either, in some places, I believe in the United States, you can just buy the permethrin and you can wash your clothes in it, and it will stay in for, I believe it's like 50 washes, or it's an exceptionally long period of time. In Canada, Mark's Work Warehouse is one of the places, not to promote anyone, but they actually have permethrin impregnated clothes that you can buy directly.
Yeah, they call it no fly zone.
Yeah.
Yeah, it's great. The fashion's not too bad, actually. And then I guess with picaridin as well, there's the other insect repellent as well as DEET, and we usually recommend 20 to 25% every 6 to 8 hours.
Absolutely, and safe for children, children in a low cost and pregnancy.
There's over 50 years of data of safety there.
Yeah.
What about lightning round from you, Anne, Henry? You have a wealth of knowledge over here.
I think be careful what you eat. Buyer beware for some of the things. And if you bring home a friend, then try and see somebody who knows how to treat that friend.
I guess that's a double innuendo there. I'm just like, oh dear.
We like to really give the same advice, the bug repellents, and being careful what you eat. We see a lot of kids, and I tell the kids, this is the one time you'll hear from a doctor, it's okay not to eat the salad. And, and that hopefully that they remember that. Sometimes I think I scare people out of their trips, but I like to reassure them that, as these are infections that they're bad, but the good news is they're preventable. And if you do the right things, it's pretty unlikely you will catch them. And when we do see somebody with these infections, most of the time it's somebody who never saw us, for any advice to start with. They just kind of went blindly and did anything. But if you're being careful, I think these are all very preventable.
Great. So we've got a live audience here watching this podcast in Toronto, Canada. So are there any questions from the audience or any anecdotes? Are there any of their own travelers that have come back that you wanted to share?
Thank you, Aisha. Great presentations, a great discussion, I will say. Sorry, I was in another meeting. But have you guys heard in terms of mosquito prevention, anything about color of the clothes? Which is something that I talk to an entomologist, and sometimes I laugh about it, but it's I read something about it, but I don't know if you guys have some experience with that or any more information.
Light colored clothes are better than dark colored clothes with respect to...
Yeah.
Attractive.
And blue, actually. So there's certain types of colors of blue that attracts tsetse flies. Yeah. So actually the color that Anne and Henry are wearing, this is a prime example of the color that you should not wear to places where there are tsetse flies. So usually in parts of Africa, if you're going on safari, this is not what you want to be wearing. Because actually, so for example, Tanzania, Tarangire National Park, with the beautiful elephants and ostriches, very well known for tsetse flies, which transmits a type of parasite that you can get called African sleeping sickness. And this is from the bite of the tsetse fly that you can get this trypanosome, and you can describe this parasite for me. But I have to say that the nets that they use to catch these flies, as you're coming into the national parks, you see these blue nets that are exactly these colors. And I have to say, the last time I was on a game drive in this area, one of the German doctors that I was with was wearing that exact color. And I said, hey, Marcus, go out there and see what's in those nets over there. And I was taking a picture, and you could not differentiate him between the fly trap, given his outfit. So this is a color you do not want to be wearing on a game drive. And in the evenings, the darker colors also will attract mosquitoes.
Right,
But
so
great question. Thank you.
Right, so I think that the best one is the green, right? Is the green color? Is that correct? Yeah.
Light color
Yeah, the light.
Yeah.
Okay, good. Good.
Yeah, Steve, did you want to talk about that?
I mean,
tsetse fly?
I can talk about the tsetse fly, and we were, I guess, fortunate enough or unfortunate for the patient to actually see a case of East human African trypanosomiasis in a return traveler. So that's African sleeping sickness. So we had someone that traveled to Tanzania they got bit by a tsetse fly while they were there on safari. And the tsetse fly, one of the sort of characteristic things is it's an extremely painful bite, and people will often come back and they will say, it was extremely painful. I got these terrible bites while I was there. And even will say that I got bit through my clothing as well. This patient returned back to our site, had a fever, and ended up in hospital. We looked for all of the usual things, malaria, and then they had a black spot on their chest. And that black spot, we ended up biopsying that and looking in their blood, and we actually found the parasite in the bloodstream. And this can progress exceptionally quickly and can be rapidly fatal. So we were lucky, we made the diagnosis. At that time, we had to source the treatment from the WHO, and we were able to get it and treated the patient, and he did well. So it is exceptionally rare in travelers. I think that that's something that we should point out as well. Safari is probably definitely, I'd say, top 2 or 3 things I've done in my life. I would highly recommend it to everyone, whether it's Serengeti, Masai Mara, somewhere in Africa, but just be aware.
Yes, I have a quick question. Some of our Gorgas participants, when come to Peru, they go eat everything that Carlos just mentioned you should not do. Then they go expose themselves to everything because it's unavoidable sometimes. And there's some practice on some of them. We have noticed that they buy either albendazole or ivermectin as antiparasitic drugs, and they take them at the airport before departing. Is that a safe practice? Is something that you would recommend, or considering some parasites may not give you any symptoms? Or what would you tell the audience when they go and get exposed?
I mean, it's a difficult question. I mean, you mean that, that the travelers who were potentially exposed should buy some drugs and bring them back to their countries? Oh, I mean, I'm not really in favor of actually doing something like that. But anyway, I would like to hear, what others. What happened with our colleagues from certain countries is that they actually bought the drugs because the drugs were not available in their country. So in the case that they had actually that, then they would have the drugs. I mean, under that principle, maybe it's justifiable. Yeah.
But I think you also need to keep in mind that in many countries, and this isn't directed at Peru, but many countries you can get without a prescription on the street, and you really don't know what you're getting. So sometimes you might be getting the drug you think you're getting. Sometimes you've got a filler that may or may not be safe. And I can remember when we were in Lima for one of the many Gorgas courses I did, we had people coming in who had a fever illness, probably dengue. They took an anti-fever medicine, so something like aspirin, that actually was removed from the market in the 60s in Canada, and then they would come back and their bone marrow wasn't working anymore. So it was a toxic drug that was available over the counter, which is not licensed anywhere anymore, but it's still available. So I think you have to be careful of that. The other thing is, it's the timing. So, we can pick on a different part of the world. People love to raft down the Nile. And in the Nile, they have an infection called schistosomiasis. It's a parasite that goes through your skin. It can cause disease. It needs to be treated if you get disease. But what they do is, I don't know if they tell you before you go down the Nile or after you've gone down the Nile, but they give you the anti-parasitic. But it's no good to take it then. You have to wait 4 to 6 weeks to take it. And again, it's buyer beware of what you get. So I think it's a safer practice if you've done something, maybe to see somebody. If you're worried when you get home or you get symptoms, you go see somebody, and hopefully you're in an area where you get stuff that's safe to take and good manufacturing process and not bought off the street.
And why do you have to wait so long to take that medication?
Because the medicine only works once the parasite has developed enough. So it takes 4 to 6 weeks for that to happen, where the drug will be active. So if I take it right after I come out of the water, it's not gonna do any good.
Also sounds very lovely. All right. Any other?
One more question over here.
That was a great comment, though, and question.
So just one comment and question for you guys that do travel medicine. In my travel medicine clinic as well, I have patients get scared. It's not deadly, but it's myiasis is something that it comes in travelers a lot, and I have a lot of patients coming back. So any comments on what do you recommend to your patients when it's about myiasis and they go to this long 2 weeks travel and they're going to be in the bush in Africa and so forth and so on?
Well, as we mentioned, you had to try to avoid, the bites of mosquitoes. I'm talking about essentially dermatobia here in Latin America. Okay, I'm not talking about the screwworm, but for dermatobia, it's essentially that. All the patients that we have seen are those who actually went to the, particularly, Central America, Costa Rica is very common, as it was mentioned. Then, Ecuador, then Peru, Brazil, and they are exposed. And usually, and then by not really being protected and not following, the advice, they actually get that. So my advice will be actually to follow all what we mentioned on, to avoiding, mosquito bites, essentially.
So I actually had some patients come back from Tanzania who got it from hanging their towels and clothes out to dry there. So Steve, maybe could you comment on that?
Yeah, and so in Africa, often people will hang their either bedding or their clothes outside, and you can actually have the fly that can lay the eggs on the bedding, and then when you lay on it, it will actually introduce the maggot into the skin.
No one's going to go anywhere after this.
No, but you actually can prevent it, and typically what they'll do is they'll iron. And if you iron, the heat from the iron will actually kill it. And so then it will reduce or prevent the risk of actually acquiring that.
I think that was my grandmother ironed her underwear because they were worried about that when she was a kid, maybe.
And on that note, I think we'll wrap up today's episode of Travel Unravelled. So a huge thank you to our guests, Dr. Carlos Sayas and Dr. Stephen Vaughan. Thank you so much for joining us here in Toronto. And thank you so much to our two presidents, Dr. Anne McCarthy and Dr. Henry Wu. This has been an ISTM and ASTMH collaboration. So the clinical group of the ASTMH is sponsoring this podcast. So this is a very special episode. So thank you very much, Henry, and to the clinical group of the ASTMH for having us here at the ASTMH annual meeting in Toronto this year.
We're really excited to be working with ISTM and hope to do more in the future.
And thank you so much for this enlightening and occasionally skin crawling conversation. Remember, so most of these are unwanted souvenirs. They are preventable with a few smart tips. And so it's really important that our listeners out there do get that pre-travel advice because a lot of this can be destination specific, as you've heard from the anecdotes today. So you need to watch what you're eating and drinking. You need to cover up and use that bug spray. And if you enjoyed this live episode, share it with your fellow travelers and clinicians and other health practitioners. Don't forget to subscribe so you never miss an update from Travel Unravelled. And with that, you'll also find links, resources from today's discussion in the podcast discussion, as well as hopefully some interesting and maybe some gross videos that we might get from some of our guests today. So until next time, stay curious, travel smart, and remember, some souvenirs are better left behind.
And thanks to the audience as well.
So that's a wrap for this episode. Thank you to our sponsor, the International Association for Medical Assistance to Travelers, located on the web at iamat.org. Don't forget to follow Travel Unravelled on Spotify and on Apple Podcasts or on your favorite podcast platform. We'll post fun clips and extra resources on the ISTM website located at learning.istm.org/podcast. We're also on Facebook, LinkedIn, X, and Instagram at _ISTM_. Finally, and thankfully, Travel Unravelled is produced by Ghost Bureau out of Toronto at ghostbureau.com.
Please remember that the information presented in this podcast is intended for educational and informational purposes only. It should not be considered medical advice, nor is it intended to replace consultation with a qualified healthcare professional. The views expressed by the host and guests of this podcast are their own and do not necessarily reflect the opinions or policies of the ISTM or any medical or other health professionals, hospitals, clinics, or healthcare facilities. While we strive to provide accurate and up-to-date information, the medical field is constantly evolving, and there may be new findings or developments not included in our content. We encourage our listeners to consult with their healthcare providers for any medical concerns or before starting any new treatment. Neither the ISTM nor any of its affiliates, sponsors, producers, hosts, or guests are liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access to, use of, or inability to use the content of this podcast, or any errors or omissions in the content hereof. By listening to this podcast, you agree not to use this information as a substitute for, nor does it replace professional, medical advice, diagnosis, or treatment. Always consult with your healthcare providers for guidance appropriate to your specific health situation. Thank you for listening to Travel Unravelled. We are committed to sharing knowledge and fostering discussion in the pursuit of better health and well-being.